Hi, thanks for reaching out. Your topic is the most specific thing I have had today, and it's absolutely wonderful. Just to read it out, topical cocaine and sinonasal surgeries. So we know that you're probably not going to find like any biased information. I don't know, because it's like cocaine is like in the medical field is a widely controlled substance. But there you go. It's fascinating the access that we have in medicine to all these different bodies of research. And I want to show you ways of getting into those specifically, but I'll start out with the library catalog to show you some of the other things that you might get. But since this one is pretty high level, I'm guessing it's not going to fall outside of medicines, but I will show you. We do have to put topical cocaine, because if we look at sinonasal surgery and cocaine, it might be like an intervention for drug abuse. Topical cocaine. I should make an ad for that. And then let's do nasal or sinonasal. And let's not put the surgery yet. Did I misspell sinonasal? Well, I guess my spell checker just doesn't know it. Okay, so when you're looking at a database like the library catalog, you have to stick words together in quote marks, otherwise it'll look for topical and cocaine in different places. Are there synonyms for topical cocaine? Let's find out. There's only 108. You know, that's actually a really good idea, is just looking for that by itself. But I wonder, oh yeah, is there like a different name for it? I'm seeing topical cocaine, but then I'm also seeing this unpronounceable word. Oh, that's cool. And there might be the names of surgeries or, what do you call it? Procedures. Wonderful. Ah, isn't that fascinating? It looked like most of them were medical. What you could do is just look and you could see what discipline it's coming out of. Life sciences, science and technology. Okay, let me show you the medical databases. Let's go in with those. So you can it's easier to sort when you get into those. In databases, the easiest way to go is sort by, there's two I want to show you. One, you can sort by medicine. And since we're looking at procedures, this would be better than just health. There's a ton in here. It depends on what you're interested, but if you really want to learn one of the disciplinary databases, I'm happy to refer you to the Health Sciences Library. They are big fans of PubMed, and there's like special ways of searching PubMed. But I'm just a cheeky librarian, and I like using the easy one, which is Medline. And I like the Medline EBSCO. Why do we have OVED, ProQuest, EBSCO, National Library of Medicine? Because it's publicly funded research. And so it's available to be packaged in different ways. Your trivia for the day. So on this one, topical cocaine, try it today. Okay, so we have the same 51 that probably showed up before. Since there's only 51, I would encourage you maybe just go through and look at what they're talking about before you narrow down to the surgery. Because if we have 51 and we narrow down to the nasal or sinonasal, that cuts out maybe some of the articles. So I would encourage you, since it's a small list, go through that way. But in this database, we can also go through and look at other keywords, also called the subject headings. Oh, there's epinephrine. So we could, does it fall under any of these other ones that you want to look at? So are there other local anesthetics that you wanted to look at? You're going to know these way better than me. So I would say look at those and see what they're talking about. But if you want to, you can you can come up from the 1970s into our current era if you wanted to see what's going on right now. But you could also go up and sort by date newest. The next database that I want to show you, I'm just going to do topical cocaine. This is where we might get into patient care or interventions, or like looking at like outcomes like post-surgery and things like that. This is one of my favorite databases of all time. It's called CINAHL, and it goes under nursing, and it should be the first one. CINAHL, it's an acronym for who knows what, but this is, I think, a richer set of maybe like the ethics or looking after patients, whereas the other one is just like pure surgery or like medical procedures. Oh, so 9, but look at this. So acute toxicity, working with like intubation, pain management. So this is really, really, really good for looking at like maybe like the ethical side or the long-term side or the after effects side. So I'd encourage you to look at both of those. I hope this helps. I think this is a fascinating topic. Let me know how it goes. And if you want me to refer you to the other, well, heck, let me tell you who they are. Lydia Eccles Health Sciences Library. I'll just show you who it is. Lydia Howes. Lydia Howes at utah.edu. Lydia Howes is one of those fantastic people that knows how to do systematic reviews, which is like looking at all of the evidence and boiling it down to just what matters on a particular field. I'd recommend talking to Lydia if you wanted to do some follow-up questions. And don't feel bad that you're leaving me in the dust, because Lydia specializes in this stuff. But you also have like a whole Eccles Health Sciences library to work with as well. I hope this helps. Have a good one.